Hello everyone, my name is Beth and welcome back to NF Talks. Now, with it being Brain Tumour Awareness Month, I will be talking about various brain tumours that people with NF1 may potentially get along the lines. Now, the first brain tumour I will be talking about is called a pilocytic astrocytoma. Now, I was 14 years old when I had a pilocytic astrocytoma, and this was diagnosed after 4 times of going to the doctors. So this 4th time I went to the doctors, she turned around and said there was something definitely not right with myself. Now, prior to that, I did have a couple of symptoms that presented quite rapidly. I ended up having headaches, which turned into migraines, but I also had dizziness. I kept hearing things. My balance and my gait was extremely off. And obviously this 4th time I went to the doctors, they turned around and said, something's not right. Something neurologically isn't right. So this was on a Monday. This was back in 2007. This was on a Monday. She ended up getting me referred to a hospital. On the Wednesday, I had the letter to get to the hospital on a Friday. This was on the 9th of February 2007. So on the 9th of February, that was okay day. I was off that day anyways to deal with a prior health condition, which was my scoliosis. And I went to see this professor, me and my mum, and she did a thorough neurological exam that was so thorough that my mum had never ever seen this examination process on anyone, let alone a child, so thoroughly. This professor originally thought that I had a stroke. So she ended up paying for this taxi to another hospital to get an emergency MRI scan. About an hour later, I was in a ward. The specialist came and turned around. It was a brain tumour. Pilocytic astrocytoma is what is known as a grade 1, and it is fairly common with people with NF1, especially children. So I ended up having the surgery to take it out, but because of the brain tumour, it was the size of a golf ball, potentially bigger. But around the tumour, I had a cyst that had grown, which resulted in some of the symptoms which I presented with. And on top of the cyst and the tumour, I had hydrocephalus as well, so they had to drain the fluid off my brain. Now that is gone, but just because it's gone doesn't mean I still have long-lasting effects. Like any brain injury, any brain tumour that's been taken out, once the brain has been damaged, there is no medication or cure that will repair the brain, because the brain is so delicate. So because of the damage to my brain, I am brain damaged and there is a hole in my brain. Now, that's gone, but I do have another brain tumour called an MBNT. Now, a MBNT is another rare brain tumour. There is around 114, 115 people with this brain tumour. Now, this brain tumour is not necessarily part of the NF1. It potentially might be. That is something that I may have to discuss in the future. Now, this brain tumour, MBNT, is called a multinodule and vacuolating, please forgive me, I cannot pronounce things, vacuolating neuronal tumour, which is a rare benign WHO grade 1, so it's another benign tumour. But as we all know, benign does not mean fine, especially within the brain itself. So it is often found with people who are young to middle age. Now, I am 33, so I'm around about the median age. And it usually appears as quite bubbly, like little bubbles in the brain, like a cluster. So like an aero bar or a whisper is best to describe what this brain tumour looks like on an MRI scan. And it's within the subcortical white matter. So quite a lot of us have white matter, but a lot gets more as we get older. And this brain tumour is associated with seizures and headaches, which I do have headaches. Seizures, I am getting them, especially focal seizures where I'm just blank out and I'm not aware of my surroundings. But we also think I'm potentially having seizures at night as well. Now these are leave me alone tumours, so it is best to just keep an eye on them. So they are leave me alone brain tumours, and they don't necessarily require surgical intervention unless they pose a threat or they get bigger. Now, symptoms of brain tumours vary, and many of them are associated with headaches, late onset epilepsy, and many brain tumours do not have any symptoms at all. So, which is why people with NF1 must get a brain scan, because we are highly more likely to get brain tumours than any other people. And it's basically like watchful waiting. Now, other brain tumours that people with NF1 may or may not get or optic pathway glycomas. Now, optic pathway glycomas are another common brain tumour associated with people with NF1 because they are situated obviously in our optic pathway at the back of our eyes, which is why we have to have, that's my dog, annual brain scans and annual imaging within our eyes, so we have to get our eyes tested, which is one of the reasons why I wear glasses. Now, we also can get brainstem gliomas. We get low-grade gliomas, which again are things like the pielocystic astrocytoma and the MVNT, as well as other various tumours. There are high-grade tumours, which are more rare, which are the rarest of the brain tumours that we can get. We can also potentially get, again, please forgive me for pronouncing these words because words are not my best forte of pronouncing. Glioneural tumours, desmoplastic gliomas, gangliomas, pylomyxoid astrocytomas, which are another variation of the pielocystic astrocytoma. There are a subtumour. Medulloblastomas and glioblastomas, people with NF1 can potentially get. Now, having a brain tumour with NF1 is around 15 to 20%. So we are more likely to get brain tumours than the general population. Other tumours are around 5%, and the rarest brain tumours are less than 1%. So just because we have NF1 does not potentially mean we will get all these brain tumours, but this is why it is vital that we do get our annual scans. And if you don't get annual scans, it is best to seek out your professional, your specialist who deals with the NF1, and request a brain scan if you can. Now, benign, as I keep saying, does not mean fine, which is why we have to be very, very careful with brain tumours and with our tumours itself. So just because we get these tumours does not mean that we are in the dark, if you know what I mean. If we just have to sit and wait, make sure we're okay, get these scans and any medication if need be. Now, with just like the rest of our tumours, with brain tumours, we have to be very, very careful because they can potentially be grow into MPNSTs, which we know are malignant peripheral nerve tumours, which with people with NF1 can be quite daunting. And we have to, like I said, be careful, make sure that we keep on top of things and make sure that these tumours don't get into plexiforms, because obviously the brain is so delicate. There are so many nerves within the brain, and the brain connects to every single nerve in our body. So I just want to make sure it's aware that I am not a professional. I am just making sure that people with NF1 are aware, and if people are worried, please seek out your professionals, your doctors, your GPs, your NF specialist nurses, anyone, your neuro-oncologist, anyone who helps you deal with your NF, because this is the internet and I cannot diagnose people, and these are my opinions and my experiences with tumours. Now, it is also aware that with brain tumours, there is some potential risks of if we do get chemo radiotherapy, that it may not always work, because with NF1 we know that a tumour can come back. So I hope everyone is okay. Now, next month's segment will be on autism, because next month, April, is Autism Awareness Month, and I'll be going into more depth because I have autism. I also potentially have ADHD, and I will be discussing more in depth of autism and how people with NF1 can potentially have autism, as well as other neurodivergent conditions such as ADHD, OCD, ODD, possibly bipolar as well. So I will be going more in depth into that, and the more confident I get, the longer these segments will be. Now, May is NF1 Awareness Month, with May 17th being NF1 and NF Awareness Day. May 22nd is NF2 and Schwannomatosis Awareness Day. So if anybody comes across this and who has NF1 and NF2 or NF2 and you would like to come on, please, you can, on the links below, I will have my Instagram page. So you're more than welcome to message me, and I will set up an interview with people with NF1 so we can discuss our differences, so we can highlight NF1. And if someone has NF2, you're more likely to help me with that, because I myself do not have NF2 and have no experience with NF2. I only have NF1. So I am looking for people with NF1 and NF2 to discuss how their NF1 affects not only their life but their loved ones, and how someone with NF2 or schwannomatosis affects their life in NF2, to see how we can grow as a community and get these more out. June will be scoliosis, and I'll be going to talk about that because I have scoliosis myself. I am over 21 years with having scoliosis with metal rods. So please, if you do have NF1, discuss with your care team and keep an eye out on your brain tumours. Make sure that your specialists do your scans, and I shall see you all later. Bye.